Welcome back, everyone. Ladies, did you know that you can get cancer of the fallopian tubes? This was a new one on me. This is particularly true if you have a history of breast or ovarian cancer in your family. Although this is the rarest cancer to affect the female reproductive system, it's yet one of those cancers that is difficult to detect, and this makes it potentially deadly. Interestingly, for most women diagnosed with fallopian tube cancer, the cancer starts somewhere else in the body, later spreading to the fallopian tubes. So let's look at who is most at risk. More than half of women who develop fallopian tube, or for that matter, ovarian cancer, are over the age of 63 and usually have a family history. Ethnicity also plays a role, with people living in North America, Northern Europe, or of Jewish heritage also at added risk. But there are other risk factors as well, such as hormone replacement therapy, infertility problems, or having no pregnancies, obesity, and some very rare syndromes and inherited conditions. As for the symptoms, well, they're very vague, but they could include abdominal pain or bloating, abnormal menstruation, chronic back pain, constipation, indigestion, or a bloody vaginal discharge. But again, like we just said, these symptoms are very vague, so they could point to a multitude of other conditions that have nothing to do with fallopian tube cancer. But the problem with this cancer is because it is so difficult to detect, the likelihood of it spreading is high. So what happens if you are diagnosed with this? You will likely need surgery to remove the uterus and the affected fallopian tube and ovary. Should it have spread, you will need to undergo chemotherapy or other targeted therapy. Ever wondered about the cost of a hysterectomy? According to Health E-News, costs can range anything from 50,000 Rand to 100,000 Rand. As for chemotherapy, one session of chemotherapy comes in at a whopping 15,774 Rand per person, and this is according to Groote Hospital. Remember, again, this is only for one session of chemotherapy. Scary numbers indeed, especially as we know that medical aid schemes are unlikely to cover the full cost of treatment. Ladies, take out additional cover if you can. There are so many in the market to choose from. My personal favorite is the female cancer cover by Total Risk Administrators, which retails from just 130 Rand per month and covers a range of female cancers. Do your research and make sure that you're covered. Of course, prevention is better than cure. Can this particular cancer be prevented though? Medical professionals are not sure, but they do recommend breastfeeding if possible, cutting back on alcohol, not smoking, choosing hormonal birth control options, eating healthy, and staying physically active. Most important of all, do not neglect your annual screenings. And if you have a family history of any of these cancers, consider taking a genetic test to check for changes to the BRCA gene, which can show if you have a BRCA mutation or a syndrome that increases the risk of gynecological cancers. Till next time.